He's the chair of the Department of Supportive Oncology at Atrium Health Levine Cancer in Charlotte here. He holds the inaugural Hemby Family Endowed Chair in Supportive Oncology and is professor at Wake Forest of School of Medicine and active member of the NCI designated Wake Forest Baptist Comprehensive Cancer Center. It's a pleasure to have you here, sir, and I'm really delighted because I've had dinner with Declan. I always say doctor, and he says, please call me Declan. Are you going to do that tonight also?
Absolutely.
Okay, good. Perfect. Dr. Walsh is really an international... You saw how that went? Yeah. So Dr. Walsh is recognized as an international leader in supportive and palliative care. He founded the first hospital-based palliative care program in the United States at the Cleveland Clinic, which became a World Health Organization demonstration project and earned international recognition. He later then served as founding chair of palliative medicine in Dublin, Ireland, and has held academic appointments at the Cleveland Clinic, Ohio State University, and Memorial Sloan Kettering Cancer Center. A fellow of the American College of Physicians and the Royal Colleges of Physicians in Edinburgh and London, Dr. Walsh is also a founding member of the European Association of Palliative Care and the American Academy of Hospice and Palliative Medicine. He serves as editor-in-chief of BMJ Supportive and Palliative Care. He's received numerous awards for his pioneering work, most recently the 2023 ASCO Supportive Oncology Award, and recognition in 2025 as an inaugural fellow of MASCC. His efforts have been truly transforming the way cancer care is delivered worldwide. I've had the honor of getting to know Declan, and it's really a pleasure to have you here, sir. Thank you so much for joining us tonight.
Well, thank you very much, Mark, and it's great to get together like this and all of the arrangements in such an elegant setting. So, and thank you all for being here this evening. Mark forgot to mention that I'm also an accomplished wine drinker, which I actually feel is one of my more important accomplishments, and one I like to reflect on at regular intervals. So thank you very much for the kind introduction. So I'll try to be brief because I know you've got a wonderful meal going on and also in front of you. But I did want to make a few remarks about how we came here for this very special evening and what we're trying to accomplish both now and in the future. So somebody remarked to me one time at a dinner that the big challenge we all face in life is that we remember it backwards, but we have to live it going forwards. And that is something we all struggle with every day. And when I met Kenny, and Kenny reflected to me on his memory of his cancer experience and how that affected him and his life, it so resonated with me. We got talking about what happened to him, his involvement with some of the services that we're fortunate enough to be able to deliver here in Charlotte for our cancer patients, and how that affected him and his experience of a very complicated and often difficult cancer illness. And so that memory has brought us together here for this inspirational event, and Kenny has brought us together to build on that experience, but to turn it into a positive and inspirational and transformational approach to how we might think about cancer care, both now and in the future. And so as we think about the delivery of these services and the opportunities that they bring, I also want to reach out and thank Rachel and Amy for all of the hard work that I know that you guys have put in as well, working with Kenny in this very special series of events. So thank you. As we think about supportive oncology, and people say, you know, ology, doctors always talking about various ologies. The idea really is a very simple one, and Sandra already has been very eloquently described her experiences, and thank you so much. It was really heartfelt to hear your observations on how your journey has gone. And back about a decade ago, in discussions about the development of the Cancer Center here in Charlotte, one of the ideas was, could we do something transformational about cancer survivorship? And cancer survivorship is a big bucket, if you like, of a lot of different things. It includes music therapy, it includes pain control, it includes nutrition, it includes rehabilitation. A lot of different things fit into this, and I don't have time, and you don't have the patience to hear about all of them tonight. But there's a lot of things in there. And the idea was, we want excellent care for the cancer patient who has a specific disease. We want excellent care for that disease. But we also want excellent care for the patient who has that disease. And that the two of those things should come together in an innovative, comprehensive, and multidisciplinary program that will deliver the best experience for that patient and their family, wherever that is possible, as they confront a very difficult, complicated, and sometimes debilitating illness. So over that decade, we've been putting together a number of services and programs. I mentioned nutrition and rehabilitation, for example, so that these are available and accessible. And we currently deliver these services at 7 locations in the Charlotte metropolitan area, and provide over 35 different specialist services for cancer patients that they can access at any of those locations. So in total, in a typical year, we have over 150,000 clinical interactions with patients, whether it's in the nutrition area, it's in psychotherapy, it's in pain management, cancer rehabilitation, and so on. So it's a very active, vibrant, and growing program. And as we've developed these services and programs over these years, we feel that we've come to a place where we serve as a potential model, a national model, for how these services can be delivered, how they can be organized, and how they can be grown and further developed. And the sad reality is that most cancer patients in most places in the world simply do not have access to these services and programs, including in some major cancer centers in the United States, where these services and programs are not given the visibility, the resources, and the importance that they surely deserve. So we think that we can build on what's been accomplished in Charlotte. We think that we can promote this as a national and international model of how modern cancer care should be delivered. And going back to what Sandra said about whole person cancer care, that's what we're all about. We want the cancer patient to feel at every turn in the road, whatever that turn may be, that we have their back, and there'll be always somebody there, whether it's a music therapist at the right time, or a counselor, or a physician who really cares, as Tony referred to, about how that person is feeling in terms of their symptoms right now, and they're going to do something about it. So what I would say to you tonight is thank you for being here. Please join us in this journey. Join Kenny and his family as they've reached out in such an innovative and meaningful way. And there's a long road ahead to do this at the highest and best use, regionally, nationally, and internationally. But we feel with the leadership that we have in our cancer center, with Dr. Sullivan, who you're going to hear about from Dr. Messa. We really are in a great place, on a great road, heading in the right direction, and we have a scalable, transferable, and meaningful business model also to develop these services, not just here in Charlotte, but for every cancer centre around the world. Thank you very much for being here this evening.